Rosacea. Rosacea is a chronic skin condition that manifests as redness on the cheeks, nose, then forehead and chin. What are the causes? Can we prevent it? Who are the people at risk? How to overcome? Here are our explanations. Rosacea. What is it? Rosacea is a chronic skin condition that manifests as redness on cheeks, the nose, forehead, the chin. As the disease progresses, these rednesses become permanent. Small dilated vessels, called telangiectasias, or couperose, appear on the cheeks and the wings of the nose. Small red pimples or papules also appear. Rosacea usually begins around the age of 30 and mainly affects people who have fair skin and eyes, a tendency to blush easily. It is a condition that gets worse over the years, especially if not treated well. In many people, symptoms progress in a cyclical fashion, with periods of worsening alternating with periods of remission. Long called acne rosacea, rosacea should not be confused with acne that occurs during adolescence. Blackheads and whiteheads are almost absent, and the course of the disease differs. Moreover, the factors causing these two conditions are very different. Rosacea. Who is affected? Rosacea can affect anyone between the ages of 20 and 70, but adults between the ages of 30 and 50 with fair complexion and whose skin tends to redden easily are more often affected. From 3 to 10% of the population would be affected by rosacea, to varying degrees. In Canada, more than 2 million people suffer from rosacea. Women are more prone to rosacea than men, the latter being more prone to developing rhinophoma, which is characterized by a red, swollen and bumpy nose. This is a very advanced stage of the disease. Very rarely, rosacea can appear in children, in the form of redness mainly affecting the cheeks. At this age, it is common for eye symptoms, such as red eyes and swollen eyelids, to precede skin problems. What causes rosacea? The causes are unknown, but according to some studies rosacea could be attributed to a dysregulation of the immune system concerning the skin, hyperreactivity of the blood vessels in the face, which dilate excessively. This is what creates the redness and the sensation of heat. Microorganisms such as bacteria or mites of the Demodex folliculorum type. An abnormal reaction of the skin to the sun contrary to popular belief. Alcoholism does not cause rosacea, although even moderate alcohol consumption can make it worse. Certain diseases affecting the skin, such as lupus or scleroderma, can be accompanied by skin lesions similar to those of rosacea such as telangiectasias or redness. It is therefore essential to consult a doctor to confirm the diagnosis. Finally, the continual application of cortisone-based cream to the face can lead to skin lesions that are visually identical to those of rosacea. In this case, it is corticosteroid-induced rosacea and the application must be stopped. How does rosacea develop? Rosacea progresses differently from person to person. 4 subtypes have been established too, which were previously considered to be the different stages of the disease. However, the disease never progresses to the supreme stage in many people and most patients have a combination of subtypes. It is therefore impossible to predict the course of the disease. Subtype 1. Erythematotelangiectatic rosacea. Erythematotelangiectatic rosacea is characterized by excessive redness on the face and neck, after a meal, after consuming alcohol or hot drinks or during a change in temperature. These excesses of redness, called vasomotor or congestive flushes or flushes, last a few minutes and then disappear. This is often the first symptom of rosacea, a redness, or erythema, permanently present on the central area of the face, in particular on the cheeks, the nose and the middle of the forehead. Small vessels under the epidermis become visible and create fine red lines, especially on the cheeks and sides of the nose. This is called telangiectasia or rosacea. The redness of the skin can mask them, but the red lines generally reappear when the redness fades. The skin may become dry, rough, with burning and tingling sensations. Subtype 2. Papulopustular rosacea. Papulopustular rosacea is characterized by small solid red pimples or papules, or filled with pus or pustules, besieging the face, adding to the erythema, telangiectasias that may be present, redness that persists in the central area of the face. Subtype 3. Phymatous rosacea. Phymatous rosacea corresponds to the subtype with the most marked symptoms. The sebaceous glands of the nose increase in volume. The pores dilate. The skin thickens, forming fleshy bumps or blisters, called nodules. The nose is the part of the face that undergoes the most deformations. This hypertrophy, called rhinophima, affects men in 95% of cases and occurs after the age of 50. Rhinophima requires surgical correction. Subtype 4, ocular rosacea. Ocular rosacea is characterized by eye irritation, which becomes red and dry, excessive tearing, sensitivity to light. Ocular rosacea affects more than half of people with rosacea. Other symptoms include conjunctivitis, inflammation of the eyelids or blepharitis. The irritation remains minimal in the majority of cases. If the situation worsens, it is necessary to intervene quickly under penalty of involving a strong reduction in the vision. Ocular rosacea is sometimes the precursor to the first skin symptoms.